Okay, Roman, thanks again for joining me.
Hi, how are you?
Part three, I'm doing well. This is going to be maybe a little even more speculative
Okay.
than what we've done before.
Speculation.
Um,
Exciting.
but let's continue. So, just as a review, we had, I think, last time, the last two sessions went over first scientific medicine and then Hippocratic medicine in terms of the understanding of what a diagnosis is. And and then if I want to summarize the scientific, you know, tradition, if you will, or methods, I mean, it's primarily based on the view proposed by Descartes that the body is a machine, and that the disease is a specific defect in the parts of the machine, or maybe the relationship between the parts, and so forth. And therefore, health is viewed as the absence of disease. Using the quip by Descartes of a healthy body being a well-made clock. And therefore, in that view, a diagnosis is really a description of the defect, right? And the reasoning, diagnostic reasoning is a process of detection, and that's why we've imported into medicine this whole process of uh, false, the receiver operating curve of a false positive test and false negative test and that sort of thing. I mean, all that stuff that we've imported from signal detection theory is now sort of bread and butter in medical diagnostic reasoning. In contrast, um, Hippocratic medicine, as I showed, or hopefully I showed, focuses on the sick individual by presumption, by sort of principle, and therefore tends to focus on the whole. And in the Hippocratic way of viewing health and disease, health is really a state of balance, or a state of proportion, and disease is the absence of health. So health is really the primary thing that we grasp, and then that we recognize, and then disease is really a deviation that we can that the mind can sort of abstract, so to speak, um, from the normal state of things. So disease is the absence of health. So that's the summary. Any questions before I move on here?
I think we're set.
Okay.
Go ahead.
So now I want to explore a little bit more this sort of Hippocratic strand, or at least what I infer from it. And I'm going to make a little detour here. You've heard of the Anna Karenina principle?
I have not.
You've heard of the Anna Karenina quote, all
Oh,
happy
yes.
families are alike and each unhappy family is unhappy in its own way.
Of course, yeah.
Right. So that's a very famous quote from Tolstoy.
Is it also a principle now?
Yeah. As it turns out, I didn't know it, but it is. It's a principle. I would say you might call it a principle in epistemology. And apparently it was proposed by Jared Diamond. You know who Jared Diamond is?
Right.
He wrote that book, Guns, German Steel.
Yeah.
So anyway, the principle, if you go in Wikipedia and click on the Anna Karenina principle, you will see it defined as follows. A deficiency in any one of a number of factors dooms an endeavor to failure. Consequently, a successful endeavor is one where every possible deficiency has been avoided. Okay? So again, if we go back to the quote from Tolstoy, all happy families are alike. Each unhappy family is unhappy in its own way. So there are many, many different ways to be an unhappy family, but only one way of being a happy family. And likewise, so I think Jared Diamond, when he proposed this thing, he was thinking about the evolution of things, and there are many ways, many dead ends, evolutionary dead ends,
right?
But only one thing one way to produce a certain success, and that sort of thing. And people have adopted that in many different ways. So as it turns out, this Anna Karenina principle, and also I discovered that from that Wikipedia entry, was anticipated by Aristotle. So there's an Aristotelian version of it, where that's the quote from the Nicomachean Ethics, where Aristotle says, it is possible to fail in many ways, while to succeed is possible only in one way, for which reason also one is easy and the other difficult. To miss the mark is easy, to hit it is difficult. And then he goes on to say, for men are good in but one way, but they're bad in many ways, or bad in many, right?
Hmm.
So that's kind of the same idea. That there's only one way of being good and what. So it seems to me, and this is my idea. I don't know if anybody else has thought of it in those terms, but you could apply it, or adapt it to
Right.
medicine and say all healthy people are alike, and each sick person is diseased in his or her own way. Okay, so again, that would be the Hippocratic view, at least the way I interpret it, that that health or balance or what, I mean, there's only one way to be in balance, but there are many different ways of being sick and being out of balance in that sense. Okay, so if that's sort of the view, then you could think of Hippocratic diagnosis. Number one, not a specific defect to be detected and described, which is the mechanical view, but a way, right, or a pattern of being sick,
Right.
whose recognition helps physicians help the sick. Okay, so that would be sort of the view, and and here I add that helps physicians in the plural help the sick, because Hippocratic medicine is a collegial practice, right? It's not something that one does by contemplation on your own. And we know that also from the oath, right? I mean, the oath has the part where you acknowledge, a debt to your teacher, and you promise to do things to the sons of the teacher, that sort of thing. I don't have it in front of me, but if you look at the oath, one of the points of the oath is um, that acknowledgement, and therefore, and that we know that historically, we know that from the Hippocratic texts, the other texts, that it was there was a school, it was a collegial thing, right?
It's
So
a
so
group activity.
it's right, it's productive and so forth. So Hippocratic medicine is a collegial practice, and therefore a diagnosis, in my view, is kind of a convention among the members of the college, right? It's sort of a convention or a label applied to a pattern of disease, right? A way of being out of balance that the college of doctors, of physicians, right? The school finds useful. So it's very practical, right? So it's a community of physicians sharing their impression about what they encounter and their day-to-day practical activity, throughout the experiences, and then discovering that there are certain ways of classifying things or categorizing things that is helpful and useful. So therefore, it's not really looking at the machine, finding the defect, labeling describing the defect, and the diagnosis is that, and it's going to be more of a convention between doctors of what is helpful to help the sick. Okay, so there are these two aspects. I'm sorry. Yeah, one that is conventional as opposed to formal, right? It's more conventional, and two, that it's more of a pattern.
So it's more
Uh,
organic and
yeah, correct. More organic,
self-growing.
more practical, and I think we'll see that when we get back to our scenarios, COVID related scenarios, in a little bit. Um, but I want to say that there are caveats to what I just said, because there actually no such thing as a Hippocratic diagnosis, as opposed to a scientific mechanical diagnosis as proposed by Descartes. Descartes was a philosopher, and therefore he was very explicit in what he meant. And then subsequent to him, other people, and people in, certainly in the modern days, have thought about diagnosis in such sort of formal philosophical terms, and trying to identify the defect and the mechanism of the disease and so forth. When you read the Hippocratic texts, it's not as all that clear. So essentially, what I've done in the last, today and in the last couple of sessions, I've made some inferences. I mean, it's really my thoughts about what a Hippocratic diagnosis, or what an idea of diagnosis would be, um, if if it had to be made explicit by Hippocrates or by the people, by the ancient Greeks, if you will. And what makes it even more tricky is that um, the word diagnosis, even though I always thought that it was a Greek word and it must be in the Hippocratic text, it actually was invented. Guess when?
That's fairly recent.
1634, right?
Oh,
Essentially during the scientific revolution. So this is from the dictionary, the Merriam-Webster dictionary. They say the first known use of the term diagnosis is from 1634, with its meaning defined as in sense 1a. And sense 1a is diagnosis being the art or act of identifying a disease from its signs and symptoms.
hmm.
So that's very interesting because it's from the time of Descartes. I'm not sure where they have that reference that it was, its first use is in 1634. I'd be very curious to know where, who used that first text. But basically the idea, actually, what happens is that it's not really a Greek term. It's New Latin, and it's sort of these hybrid. So it's a specific term of art in medicine, with these new terms being established at that time in the 17th century by doctors using Greek terminology. Okay. And then, or sometimes Latin, and sometimes hybrids, as you can see, sort of compound words made with a Greek root or a Greek prefix and a Latin, term, or vice versa, and so forth.
Sure.
So it's these are sort of medical. So diagnosis is a medical, term of art from the modern period, right? And then the definition, at least according to Merriam-Webster, is that in those days, diagnosis was employed in the 17th century as the act of identifying disease from its signs and symptoms.
Hmm.
Okay, which is not controversial. I mean, that can be viewed in the two different ways that I've sketched. It can be viewed either in the scientific way or mechanical way as describing the defect, or you could also view it in the conventional way, the Hippocratic conventional way, as you see a patient and then you recognize something that other of your colleagues have also recognized, and together you sort of put a label to it.
Wonder
That sort
how
of thing.
conscious the word creation was, because gnosis is
Knowledge, right?
knowledge, but
Correct. Right. So exactly.
generally in the Western context, gnosis is most often, I guess, brought up in the context of the Gnostics and special
Exactly.
knowledge.
Right, exactly. So apparently the Greek term is more complex. It's not gnosis itself, but it's I have it here in this next slide. Uh, so this next slide is from a dictionary, an online etymology dictionary. So for diagnosis, they say, they define it as scientific discrimination, especially in pathology, the recognition of disease from its symptoms. Again, so that's the same sort of definition. And here they date it not, Merriam-Webster dated it to 1634. Here, this etymology dictionary, close enough, 1680, right? So it's medical Latin, application of Greek, diagnosis, which is a discerning or distinguishing from the stem diagnos diagnoskine, or whatever it is. I mean,
Hmm.
discerning, distinguishing. And then they add a few more terms, to try to sort of expound on this. They say to know thoroughly, to know apart from another, and so forth. And I've seen another
It's very dialectical.
dictionary, correct, dialectical, but in this, there's a sense of completeness. So the diagnosis is sort of a complete, um, to know thoroughly. So here they have it as to know thoroughly, and
Right.
somewhere else they say, I
That's a
heard the word
different
to know
definition of dia.
completely. It
Right.
is correct. It's the definition of
Because
dia. Correct. In dia
like
has the sense of
diagonal.
completeness. Correct. Correct. So there's complete knowledge. So one could think of diagnosis as being kind of a complete knowledge, a more complete knowledge, which I think is very important to sort of keep in mind, think about, because then if you have that, then you might think that ideally what a diagnosis is, the diagnosis should capture, cause, natural history, prognosis, all that stuff as specifically as possible
What's interesting
to
about
help
the term
physicians help us.
itself
Yeah, go
is
ahead.
that it seems to, in itself, already contain this potential for two separate paths to be created, because diagnosis, the dia, it can be, as you point out, thorough, complete, whole,
Mm-hmm.
as in penetrating through the entire object of this knowledge. So in its totality, but it can also be seen as penetrating through and therefore dividing, creating A versus B. So it's almost anti-complete. And depending on how you read the text, whatever your attitude may be, you can go either way.
Right. That's a very, very interesting thought. Very interesting thought, Roman. And I think you're absolutely right. You're absolutely right. And it's so again, if it was coined in the 17th century during this era of philosophical revolution, with these mechanistic ideas being, you know, capturing the imagination of people, and then doctors, you know, soon enough, the imagination of physicians. Yeah, you could read it. And again, you know, so the early mechanicists, you know, the Cartesian ones, I mean, certainly with the fervor of the philosophical fervor of the 17th century, I think for them, they would have, both would have been compatible with mechanicism in a way, because I think the shortcomings of the mechanical worldview, you know, didn't come till later, maybe in the 18th century, 19th century, and certainly now, you know, most people, you know, in a way, realize that mechanicism uh, cannot you know, capture what
It's insufficient.
right, what biological reality is. Certainly, and maybe even beyond biological reality, but certainly on at the level of organisms, uh, cannot be captured. But certainly in those days, I mean, at the 17th century, it's possible that they thought that by penetrating through, as you say, you actually get a complete answer, right? That you have to get to the mechanical defect in order to understand, you know, the whole, you know, what's ailing the whole thing. So anyway, so I think that's those are very interesting things, but the problem is that this ideal now of complete knowledge, you know, having a diagnosis. I mean, if you say you have systemic lupus erythematosus, that would give you sort of knowledge of the causes, knowledge of the you know, of the pattern in which the person is going to be sick, and knowledge of what the natural history will be, and what the treatment should be, and so forth. Of course, practically it falls short every single time, right? It's very, very infrequent that we have the diagnoses that we have, and I think that would be the case whether you take the mechanical approach or whether you take the Hippocratic approach. You know, it falls short of that ideal all the time. Um, and so um, so what happens in practical terms is that the description of the defect, simple as that, I mean, if you know, that's all you have, stands in, you know, it serves as a diagnosis, and it's a stand-in for a diagnosis. For example, when I say, you know, if I want to tell Anish that I have a patient with a pulmonary embolism, that's all I'm going to have. So I'm going to have, that's a mechanical description. It's a description. There's in which part? Well, in the lungs, in the artery of the lung, there's a clot. So there's a defect, right? There's an obstruction that shouldn't be there, and it's abrupt obstruction. And that's going to be my diagnosis at the end of the day, right? That's all I can have, right? So I may later on, maybe we can enrich our knowledge, and now we can find perhaps genetic predispositions for why there's a clot, or this. Maybe you can come up with a better term of you know, a better diagnosis than just a description. Maybe you can come up with a term that will say what it is. So maybe if later on you actually find out that the patient has pancreatic cancer, right? And then you can say, well, the pulmonary embolism is a consequence of having this state of enhanced coagulation that people with pancreatic cancer have, and so forth. So you can put it together, but our labels are still sort of very discrete, stand-in, you know, labels that are descriptive, that describe the parts and describe the um, you know, the mechanics of what's wrong with the patient. And so, and I think at the end of the day, most of the time it's going to be like that. That it's not going to be the ideal sort of holistic view that the ancient Hippocratic physicians could have. And sometimes, maybe they were blessed by their lack of technology, their lack of ability to actually uh, verify whatever labels that they had, when they said, well, you have this quartan fever, and and this and that, right? I mean, they could be self-satisfied, and it was sort of a little bit, what the modern critics will rail against, this eminence-based medicine, right? Where you could have sort of the pontificator clinician, declare that the patient has this or that without really having the means to be proven or disproven. And if they did, then they'd be kind of overwhelmed by the multiplicity of classification, right, of disparate patterns in which one can be diseased. So I think the Hippocratic emphasis on the whole remains important, and perhaps we'll get to that in a moment. But there certainly is the fact that in practical terms, at the end of the day, all you can have is maybe just a description of the part that is broken. Or but there's one more little thing that I may want to say here, is that because the diagnosis, again, in this Hippocratic view, is aimed at helping the sick, um, a diagnosis is made. So I think it's related to what I was just saying. It's made in an act of practical judgment. In other words, it is I, Marcus Welby, that judge that James is ill in a pattern that fits the diagnosis commonly called COVID-19. Okay?
Okay.
So it's not going to be that I, Marcus Welby, have detected COVID-19
Okay.
in the patient. Okay,
It's a
so
big
if we go back to those
difference.
to the four scenarios here that we had at the beginning of our discussion, where you have James, the 72-year-old, who, one, is short of breath, has a fever, and blah blah blah, and then the question is, does he have COVID-19? Again, so in the mechanical view, I mean, if we're strict mechanicists, and if mechanicism was true, then you would have a gold standard, by which you could make the diagnosis of COVID-19. Whereas here you don't have that. You make a judgment. So you see a guy, fever, shortness of breath, ground glass opacities on chest CT, a positive PCR um, test, and what have you. And then at the end of the day, it's still going to be sort of a judgment. You're going to say that fits with what me and my colleagues, and again, and that's true today. I mean, medicine is still a collegial, right? I mean, it's more than ever kind of a collegial endeavor. So it's still what the medical community thinks is recognizes as a pattern, a way of being ill, right? That we can term COVID-19, and we have more certainty if all these features, the fever, the ground glass opacity, the positive PCR test, and whatnot, to apply that label, to apply the diagnosis. But it still remains at the end of the day kind of a convention, okay, that we put together. And the same is true for I mean, even more true for the others. So I think if you have James, who's short of breath, has fever, has pulmonary infiltrates, and a positive PCR test for this virus, right? I think there's going to be less controversy in even if it's conventional, in labeling James with the diagnosis of COVID-19. Then, if you talk now about somebody with a stroke who has clear lungs, no fever, and happens to have a PCR test that is positive for SARS-CoV-2, do you label him COVID-19 or not? And that here it's going to have to be convention, right? So is it useful? Do we have sufficient cases like this to start to make the association between the virus and the stroke, and then label this bundle of viral agent and stroke, label it under the umbrella of COVID-19 or not? And I think right now it's sort of up in the air. I don't think there's any way to think that that's necessarily useful, but some people make that diagnosis, right? It may end up in the discharge summary nowadays. But I think this is kind of an unstable situation where you have a newly described entity, and people don't know yet whether it's it should be labeled COVID-19 or not. And even more so when we talk about, James being in the nursing home, having no symptoms whatsoever, and he's screened for, his nasal passages are screened, and we find the virus. Do we label him as having COVID-19 or not? And even more so when we talk about autopsy and cause of death and whatnot, that becomes even murkier. Um, but the bottom line is that here, I think we can see that it's we're trying to fit together when we make diagnoses nowadays in 2020. Um, that it's very strongly kind of a conventional thing, trying to identify a way of being unhealthy, right? A pattern that we think is useful. Um, and the problem now is that there are conflicts, because useful to who? I mean, we live in the era
Right,
of public
exactly.
health and this and whatnot. And so doctors are being influenced in what they do.
That was
And
my thinking exactly about
right,
how
exactly.
the
So
organization of modern industrial medicine is that it the doctor is not capable of abstaining from making a decision on a pattern. Ultimately, they will have to make that
right,
decision of classification, whether they themselves may not be sure or not about it.
exactly right. There's
So
no
the
such
convention is being sort of shoved
right,
towards a
right.
consensus.
Correct, correct. That's absolutely right. You cannot make you're no longer allowed to make a provisional diagnosis or to suspend your judgment, right? To say, I'm not sure, interesting, I'm not sure, I'm going to file it, I'm going to put that
Right.
in my file, and I'll think about it, and I'll talk with my other colleagues, and perhaps later on we'll make a decision, and so forth. You're right, we're being forced, and it's become more and more formalized, right? So now you will have with what we have already. We have these diagnostic criteria. So, sort of rigid, formalistic ways to classify diseases, and then you see, and then it becomes more of a process of detection, because the diagnostic criteria will say, that are coming top down from wherever, regulatory
Mm.
body or academia or whatnot. They'll say, well, to make the diagnosis of COVID-19, you need to have maybe three of those major criteria and maybe two out of those eight minor criteria. And so you go and you check the boxes, right? Does James have, okay, he has a fever, he has this, he has a positive test, and blah, blah, blah. Okay, he meets the criteria, therefore. So this is sort of the process of detection, which really should not be. I mean, it shouldn't be in, if we wanted to do justice to James and
Right.
to medicine in general, to the reality of what organisms are, and what diseases are and what diagnoses are. So I think you're right. I mean, there's this formalization, but I think nevertheless, I mean, we still at the same time um, practice by convention, and try to practice reasonably well. So my next slide, I think, has sort of a summary of the two. I mean, a brief summary of the two approaches: the scientific diagnosis, or the scientific understanding of diagnosis, and the Hippocratic or clinical understanding of diagnosis. So the scientific would be based on a mechanical view of organisms as machines, and the diagnosis is an objective defect that is discovered, right? So there's philosophically what we call a reification, right? You make
Mm-hmm.
disease kind of a real thing, a real, and so and it's separable from therapy, as you said, because I mean, we can make our ICD-9 diagnosis, put it on a sheet of paper, and that's kind of separate from the prognosis and the therapy. But the clinical Hippocratic would be based on an intuitive sense of health and disease as an imbalance, right? First of all, you recognize that the person is not well, and in that sense, I think, James being in a nursing home, having, positive virus in his nose, uh, I think if there is medical justice would say, no, health, James doesn't have a disease, right? I wouldn't label James as having COVID. He
Right.
doesn't have any symptoms whatsoever. Maybe useful for public health reasons to mention that he's harboring this virus, but we wouldn't call him, diseased or sick,
Right.
right? but then it's right. So the disease is a pattern of being unhealthy, right? Which, one of the many ways that one can be unhealthy, and that is recognized and shared among physicians for its utility, its practical utility to the individual patient, right? So it would always be, if Hippocratic ethics were alive, we actually would not have the healthcare system that we have, right? If Hippocratic ethics were alive, we would, I think, incorporate a lot of knowledge that the scientific revolution has produced, but all of this would be um, at the service of the sick
Of the patient.
individual,
Correct.
right? At the service of the whole, and our classification schemes, would probably be different than the way they are now, and so forth. But and certainly our whole healthcare system, as you just mentioned, would be organized differently. And then ideally, the clinical diagnosis captures as much knowledge as possible, and it's always connected to prognosis and therapy, right? I mean, it would have that aim of being whole, or doing justice to the whole of the person, and what we anticipate might happen to that person. And so that's, I had another. I mean, I didn't. I think I disregarded it, but you just mentioned it, and I want to hats off to you for picking up on that. Is that you're absolutely right that our entire healthcare system is predicated on this mechanistic understanding, right? And so it forces us to think in those terms. And health insurance, for example,
Right.
would not exist if we didn't think of the body as a machine that can break down and therefore can be insured the way a car can be insured. And so that's my sort of little musings on diagnosis. And if we have another session, I'd be interested to see if you have any questions. I mean, there are many different ways we can branch out from here. Perhaps we can,
Wonder,
go ahead. Yeah.
I wonder how medicine was practiced around that time of Descartes.
Right.
1600s, 1700s.
Right.
That's
Right.
close enough in time that we still have fairly accurate, I'm assuming, historical record.
Correct. So no, it is. So it's interesting, and I think there are two things that had not happened as of yet around his time, but there was certainly one thing that happened that was kind of fairly dramatic. But let me do things. One thing that we take for granted that was not the case in those days. Hospitals and hospices were a completely separate thing than the work of the physician. So the Hippocratics invented what invented modern medicine in a way, because they invented the application of reason to the problem of health and disease.
Okay.
Right. And so they were, in that sense, they were rationalists. I mean, that was the main contribution of the Hippocratic school, was to find natural causes for diseases where previously they were works of gods, right? Divine in origin. And so that's the major contribution, along with the Hippocratic ethics, which I mentioned last time, was, I mean, really revolutionary, to sort of pledge service to the individual person, to the individual sick person, right? So it's allegiance to the sick person insofar they are sick, whether they're slave or free, right? And so that was the main contribution of Hippocratic medicine. But Hippocratic medicine was the work of the individual doctor. So there was a college, right, a school of doctors, and they were working individually. So the Hippocratic physician had his own practice, which was essentially a family practice, right? The Hippocratic, again, that's sort of a natural level. Right, a natural consequence of being holistic for the is that you didn't have specialization, right? So you had specialization in the arts, meaning they had developed orthopedic surgery in the Hippocratic school. So there was, there were treatises, there were books on orthopedics, there were books on gynecology, there were books on, this and that. So there was specialization in the knowledge, if you will, but the doctor was still sort of the family, the generalist, right?
Right.
As opposed to what you see in scientific medicine, which is a hyper specialization, right? Because by necessity, if you view the body as a machine, it will start demanding more and more specialization, and the generalist would sort of be eclipsed from medical care. So, but to go back to the Hippocratic, but Hippocratic medicine did not invent the hospital. The hospital was an invention of Christianity. Okay, and so it was in the second, third century
Right.
A.D. You have the development
Saint Basil.
of Saint Basil, others, correct. I mean, in the East, you had the emergence of the hospice, primarily attached to the church as a refuge to nurse the victims of the poor. And in that time, there was no distinction between the poor and the sick, because if you were sick, you became, I mean, essentially, if you were sick enough to require medical, attention, then you were poor. You were you were ruined, right?
Right.
So for the most part, so you had the hospital that starts to nurse um, the sick and the poor, and it was primarily a nursing institution, and it remained a nursing institution for a long time. Um, Whereas medical practice was done individually, was done in the person's homes, was done mainly. Certainly, it was true for the Hippocratic physicians. You applied medicine if you thought that there was a hope to help the patient. If you thought that it was hopeless, then you backed off. And it can be actually a little bit jarring to read in the Hippocratic texts that they would say, you just tiptoe your way out of the
Right.
situation if you think that the patient is too sick and they're not going to make it, which is contrary to right now in our culture, and I think it's an inheritance from the Christian culture that we continue to nurse and pay attention to the sick up until the end. Okay, so in antiquity, in the Middle Ages, you have the hospitals that are led and staffed primarily by nursing people, and in the Middle Ages it'd be religious people,
Right. Nuns.
right? Nuns, or you had your religious orders, the Hospitallers, and so forth. Uh, you know what? I'm going to stop here, perhaps, because that may be enough.
Another session.
Yeah, enough material because I don't want to speak, extemp here and kind of ramble.
Sure.
I'd rather maybe organize some thoughts and present something
There's
because I think
definitely a
there's something of
lot.
interest. Yeah,
Yep.
there's a lot, and maybe
It's
we'll.
changed a lot, and especially the separation between practice and nursing in the hospital. That's a major structural difference
Right,
in
right.
terms of how you approach the field.
Yeah, correct. But let me maybe next time I'll review a little bit that transition period, which I think is quite interesting. So it'd be the transition between the late 16th century, the 16th century, the 17th century, and when really medicine starts to actually be helpful, in the 19th
Right.
century.
19th century, right? At the end of 19th century, like if you're reading, Death of Ivan Illich, it's very obvious that at that point in time in the 1870s, 1880s, physicians are existing in this space where they're simultaneously legitimate practitioners and highly respected and trusted, and at the same time still quacks,
Right.
still totally fumbling around trying to figure it out.
Right. Yeah. And and it's not necessarily not the case now, except that
Right.
our fumbling around are maybe less apparent. But yeah, okay. So let's leave it at that for now, and then
Terrific.
very good. Stop the recording here.